Welcome back to the Physical Therapy San Pedro podcast. This is episode 44, and today we are going to help you all understand low back pain a little better. We will be discussing lumbar sprains and strains. I am your host, Dr. Janae Brown, and I'm joined by my wonderful physical therapy team. On my left, I have
Dr. Bay.
And on my right,
Dr. Yana.
Okay, guys, so let's dive in. Dr. Bay wrote this wonderful blog for us. And Dr. Bay, give us a little bit of insight. Why'd you want to write about sprains and strains? What's so exciting about these things?
I don't know how exciting it is, but it's very common.
Yeah, it is very common.
Most of us have experienced this in our life at some point. We made a bad decision. Maybe we didn't know something was too much for us and we suffered. So it's always nice. And I always find that when I have an injury, I have to really think about how I would instruct my patients. So writing these blogs is always a good refresher in how to cue both the people I'm helping and myself if I run into injury.
Yeah, and you said in this blog, 80% of people in their lifetime will complain of low back pain at some point. 10% of people have like chronic low back pain. So low back pain is so common. We're in our low back pain series, and we're starting with this particular diagnosis, which we see very, very often, like Dr. Bay said. So it's a really good one to start with. So thank you for writing for such a great blog. And we're excited to dive in and talk about it. So I'm going to start by going over anatomy because I stole it today. I got it. It's mine. I'm going over the anatomy.
Have fun.
I took the easy part out, but actually it's not easy. The low back is very complicated. So we have behind us here our model, Sabone Biles. She's tiny but fierce, and she'll be
very
just
flexible.
She's very
powerful,
very powerful, very flexible, very strong,
well balanced.
We're balanced, yes. You can kind of see her spine right here. And I will not be pointing to it, but I'll be giving you guys just some information about common muscles that we see that are strained and common ligaments that we see that are sprained. And we'll talk a little bit about what the difference between that is a little bit later. So, the muscles that are typically involved with a muscle strain are extensors. So they're grouped as the erector spinae, but they're the three long muscles that kind of line your spine, and they line your spine vertically from middle or medial to lateral. They go all the way up the spine, and they go all the way from the lumbar spine all the way to the cervical spine. But in the low back, the ones that we see commonly injured are the longissimus thoracis and the iliocostalis lumborum. Say that 3 times and you get a gold star. We also have our multifidi that are commonly injured in the back. The multifidi are these little tiny muscles that come off the spine and go towards they're on the vertebrae, and they go like basically on the spinous process to the facet joints, and they're multifidi that rotate the spine. So these are our little rotators, our tiny little deep rotators in the spine. Those often get strained. And then our lats are another muscle that commonly gets strained in the spine, which are big muscles that also extend our shoulders and do stuff in the upper body. But they're big, long, and they go all along the whole part of the back. You guys all know them as the lats. It's really called the latissimus dorsi for the big, long name. So those are our extensors. Those muscles all extend the spine. Then we have our side muscles, or our rotators, which you guys will know as our oblique muscles. We have external obliques and internal obliques, ones that go this way and then ones that go this way. So they cross each other like that. And those muscles, the obliques, rotate and side flex the spine. So those are commonly involved in lumbar strains. And then the last would be the muscles on the front of the spine, which are called the iliacus and psoas. Those muscles are, what did you call it, Dr. Bay? They're the
Waistband?
The waistband muscles. And we wouldn't think that muscles on the front of the spine would be low back muscles, but they actually are close to the spine. And so they are impacted often in sprains and strains as well. So those are our muscles involved in strain, common ones involved in strains. There's a ton of muscles in the back, and we're not going to list them all, but these are the commonly strained muscles. And then we have our ligaments, our common ligaments that are sprained. And those ligaments are the supraspinatus and interspinous ligaments, typically between L4 and L5. So L4 and L5 are the lower segments. Those are the common areas, and L5S1 are the common areas of those ligament sprains. And then the iliolumbar ligament, which goes from the iliacus to the lumbar spine, that's another common ligament in the spine that is sprained. So those are the common muscles, common ligaments. Let's talk a little bit about what the difference between a sprain and a strain is, because you might have heard before, I strained my back. So straining is always muscular. So if you strain strain your back, you're straining a muscle in your spine. Muscles have tendons at the end of them, so it also could be a tendon strain as well. But we typically refer to a strain as the actual muscle belly, but the tendon can be involved as well. And then the ligaments attach bones to bones, right? And so those are, we call that a sprain. If you overstretch a muscle, it's a strain. And if you overstretch a ligament, it's a sprain. So it could be a little confusing, but basically it's overstretching of one of those pieces of soft tissue. And typically we'll see the mechanism of injury of a sprain or a strain be to either an overstretching or an overloading of your spine, which will impact either your ligament or a muscle. So too much load, too much activity, maybe a load in a poor posture, like Dr. Bay described in the blog, like lifting a box from the ground, and maybe your spine is bent over in a poor position, and you're asking your body to load a little bit more than it's ever loaded. Like, for example, during Christmas, you're loading boxes and putting things away above and pulling things down, but you really never ever lift boxes, and then you go and do it during Christmas. You might sprain or strain your spine. So it's important that you keep your spine healthy and strong, so when you ask it to do those things, it can. And so we'll get into that area when we get into treatment. But essentially, overloading or overstretching will end up in a position where you might sprain or strain your back. I think my part's done. I think I killed it. So I'm going to move on to Dr. Yana, and she's going to talk to us about common symptoms that we see with a sprain or strain, and give you guys some information on some red and yellow flags.
All right, sounds good.
Take it away, girl.
Okay, so some of the common symptoms of lower back pain could include localized pain. So anywhere along those spinal segments of L1 to L5. So it could be pain right at that spine, or it could radiate into your pelvis or hips, the glutes or buttocks, and your waistband, like mentioned earlier. So it could be in the front, but it could also wrap around that lower back region. Another common symptom of lower back pain would be deficits in your range of motion. So if you're having trouble with things like forward bending, reaching for something, reaching behind you and extending that back, bending to the side or rotating, those could also be symptoms. Another super common one we get in the clinic is when patients tell us they have a really stiff back in the morning when waking up. And then also, like if they're at work and have a desk job, they'll also mention how the pain increases while working because they're sitting for long periods of time. And then usually the deficits associated with lower back pain are closely tied with the mechanism of injury, or as we call it, MOI. So an example of this would be if somebody, like what Dr. Brown mentioned earlier, if you're you strain your back lifting something heavy and something you usually don't do, you'll have issues with keeping an upright posture, extending that back fully. Some red or yellow flags you want to be aware of. So these are things that are a little more serious, and you probably do want to get medical advice on or see a primary care physician for, is if that pain is also causing nerve symptoms. So things like numbness or tingling down the legs, radiating pain down the legs, something called drop foot, where you have trouble picking up your foot while walking, issues with balancing, maintaining balance, and loss of sensation in the saddle region or urinary incontinence. Those are a little more serious, so you do want to get additional medical advice on. And then if you do go to the doctor and they do recommend reducing your activity levels, a lot of people think that means just not stopping movement altogether. But we do want to emphasize that that's not what you should do. You should still be moving within your pain tolerance because the spine likes to move and you won't, progress as well if you stop the movement altogether. All right. I think that concludes my section.
Yeah, that was awesome. We were talking about earlier that commonly people will say or feel like they threw their back out. That's a common, if you've ever heard anybody say, I threw my back out, or something like that, that's typically a sprain or a strain. That's what it feels like, that you threw your back out and that you can't move and you're kind of like stuck. So that's the original acute version of it, right? If it's really bad. Some people don't get it to that severity. They just feel like more pain and pulling and all the symptoms that Dr. Yana said. But if it's really bad, you're going to think you threw your back out. And so that's the layman kind of terminology for a sprain or a strain. Yeah.
Yep.
It's really like an umbrella term.
Yeah. Also, don't come see us if you have urinary incontinence or
We're not
any
the
of the
correct
things.
medical professional.
Yeah, don't come to us. If you have some radicular pain, we can help you with that, as Dr. Bay said earlier. But go see the ER. Go to the ER if you got some urinary incontinence. Not our specialty. And we want you to get immediate help. And we're closed on the weekends, so you will have to.
That
go
only
see.
happens on the weekends and after 6 p.m.
And after 6 p.m.
and before 8 a.m.
Exactly. We work from 8 to 5.
Never during our hours.
So Dr. Bay is going to take us right into all the things, all the feel-goods, all the things that you can do to get you on your healing journey, get you recovering, and back to all the things you love to do. So where do they get started, Dr. Bay? How does that happen?
Yes, it can be daunting, as we said, because the instinct is usually, I shouldn't move, I should rest, but that is the exact opposite, okay? So let's talk about the do's and don'ts here. So number one is avoid the aggravating activity. Do your best to stop reproducing the pain over and over again. That keeps that inflammation process at a heightened level, and it is hard to initiate healing if we keep creating the initial symptom over and over again. What you can do is modify. If you want to keep training, which we highly advise, because we said earlier, spines like to move, and it's not good to just all of a sudden lose all of your strength and mobility that you've worked so hard for. You can shorten your range of motion. You can reduce the loads. You can keep performing your squats or your deadlifts or your lunges in safe ranges and in loads that don't aggravate. Next is avoid staying in one position for too long. Like we mentioned earlier, backs can be really tender after prolonged sitting and also sleeping all night long. Some of those structures just really stiffen up or get irritated without regular movement. So we recommend that instead you break up the day with exercise snacks or go frequently on gentle walks. When walking, it's really important to swing your arms because that initiates motion of those facet joints in the spine, and that helps lubricate everything and reactivate our core muscles. Who knows what a core muscle is? I know you guys know. But audience, think to yourself really quick, it's more than your abdominals. Mm-hmm. This is a PSA, okay? Core muscles are any muscles that attach to your spine. So if you noticed, Dr. Brown talked about the low back injury muscles, but those are also still core muscles. So initiating activation of your core muscles and helping them learn to, again, restabilize the spine is extremely important. Pain is an inhibitor. That means when we are experiencing pain, our core muscles don't want to work anymore. So we must keep reminding them to wake up. Say, hello, core. Remember me? Please protect me. Thank you. So
Always say thank you.
yeah, I like to be nice to the body. If you just poke the bear, it doesn't respond well. You have to be gentle and kind.
Kind.
I use that treatment approach on a daily basis here.
Yep.
Related to exercise is understanding your back classification, and really seeing a movement specialist is the best way to figure that out. But providing frequent, what we call movement snacks throughout the day, which means maybe hourly, doing a movement that makes you feel better.
Yeah.
Very important. And lastly, to control the pain, if you think icing, heating, alternating the two, discussing the use of either analgesics, which is just pain control medicine, or anti-inflammatories, which more attack the inflammation going on. Discuss that with your doctor and see what would be most appropriate for you, because keeping the pain down is important to initiate your ability to move more confidently and let your body heal. So if you've gone through these above recommendations that I just went over, but you are not getting better, it's definitely time to seek help. A good place to start would be either with your physical therapist or with a medical doctor. Usually someone specializing in the spine or orthopedics would be the best route. But even just getting your referral to physical therapy can be beneficial. Sometimes they're going to want to image you just to check the health of the structures, depending on how you got injured, right? There's certain structures that Dr. Brown went over in the anatomy that we want to make sure don't have too much damage, or ruling out any of those red or yellow flags Dr. Yana mentioned might be necessary by your medical doctor. The doctor will direct your care, but always probably refer you to physical therapy. So that's where you meet us.
Or
Sometimes
you can come straight to us.
you can start with us, and then we can advise you what's needed. If it looks like you might need to see the doctor because you aren't responding appropriately, that's part of our job. Some people start with a chiropractor. They can be very helpful in acute situations depending on what's going on, but they are not the type of movement specialist a physical therapist is. So while they might prescribe a few exercises in the best cases, they probably don't know how to get you all the way better with their exercise training. That's where we specialize. So if you end up coming to physical therapy, which would be the best course of action for a back sprain or strain, what you can expect is to start with an initial evaluation where we will educate you about your injury. We will assess, learn your history, figure out what your back classification is, figure out what range of motions are lacking, what strength is lacking, and get you started with treatment right away. This also includes an individual exercise program, so now you have a lot more information on which exercise snacks to be performing to help your healing process. Once treatment gets started, there's 3 phases of treatment. Our first initial phase is mostly that pain control phase. So we're working on slowly getting moving more and getting that pain level down. This is usually accompanied by those beginning levels of core stabilization training I discussed earlier. Our middle phase, the second phase, your pain is down. It might be intermittent. It might be talking to us a little bit, but we can use pain as a guide to really push our strength and flexibility to regain full strength and flexibility in this phase. And then the last phase targets full achievement of your goals. So for many of our athletes, this is our return to sport phase. You're going to be pushing speed, power, plyometrics, working on correcting movement patterns that may have led us into injury in the first place. We have to say that the biggest no-no is not completing your physical therapy. The last phase of recovery, even though you're feeling good, is the most important phase, because that is how we can avoid re-injury, stay strong, and come out stronger than ever. I always think it's really fun to get young athletes in here, because physical therapy is a great opportunity to learn about your body more than your coaches can share with you. So while you're in physical therapy, you're going to be learning about your body, things you've never learned before, learning about proper care of your body, and getting your individualized program. All of our patients and athletes graduate with a great understanding of how to keep progressing themselves and come out actually stronger than ever, I would say.
I would say too.
Yes, so don't let your back pain hold you back. Come on in, and
That was punny.
I know,
That
I
was
thought
very
that was
funny.
fun when I thought of it.
I love it.
I'm sure someone said it before.
But
I'm not
you
very
said
original.
it
Today it's yours.
But today it's yours.
Yeah, I'm owning it today. But we would love to get you, healing properly
Yeah,
and as quickly as possible.
we would. And we love working with athletes, and I think it's fun for us to see. Unfortunately, a lot of our athletes end up with us because of injury, and then we get them back feeling better. But we also do work with clients who just come basically looking for, strength and conditioning. And so oftentimes some of our athletes will come in and just want to get a good strength and conditioning program. They're not sure if they're moving right, they're squatting right, they're lifting right. And we try to help them create basics. And definitely the core and the spine is part of that. You got to build the foundation. Right?
Always.
So we can talk about our own injuries because Dr. Bay was really excited about, us sharing our own personal stories.
Yeah.
So does anybody
We've
want
all
to start?
been there.
Back pain's so common, right? And so it's like we're not immune to back pain, right? Does anybody want to share? Do you guys want me to start?
Sure.
I'm going to start.
If you would love
yeah.
to.
I actually had a lumbar
for it.
sprain strain in high school. When I was playing basketball, so I think it was my sophomore year of high school. And I don't remember the actual anything other than waking up in the morning and feeling like my back went out, meaning I couldn't move. I couldn't stand up, and every movement hurt. And the only thing that felt good was really just to lay on a really hard and flat surface. And even that was uncomfortable,
What
but
they say.
yeah, but that kept my spine, every muscle locked, not moving, and every ligament kind of solid. And I think that's what most people will feel like when they really throw their back out and it's acute. So I don't remember too much about it other than it worked itself out. I slowly moved. I slowly did things. I didn't actually seek medical help at that time. I think I was pretty active, and it kind of just was able to work itself out. But it doesn't always happen for everybody that way. Yeah. Yeah.
Yeah, it really depends.
Yeah,
The good old
yeah.
phrase, it
Yeah,
depends.
it depends. Yeah. Some people can recover without any help, and a lot of people, What about you guys? Ever had a sprain or strain?
Yes, but I feel like mine is scoliosis related. So I have a top and bottom curve that I was diagnosed with when I was 12 years old. And I did have to wear a brace for it. The brace maintained the curve, so I never had to, for surgery to correct it. But I do, to this day, I'll get it. My body will tell me if those core muscles are weak because I'll get that pain again. So as long as I maintain the strength in my core, I usually keep it at bay, which is great. But something.
What you preach. You got to practice what you preach.
Yeah, exactly. And ironically, it was right before I started PT school where I had the worst episode of this. And it was because I was doing a lot of sitting and studying during one of my prereq classes. And something that I found interesting is I did start PT for it as well. But something I found interesting is I swapped my normal chair out for a stability ball. And just sitting on that alone, forced my core to stay working, staying balanced on that ball while I was studying. And that did actually help a lot.
Yeah. And
I've seen you in your office with that ball.
Yeah, and now I have one.
To this day. We talked about being overstretching or overloading, but poor posture would be an overstretching of your muscle. So that's commonly what we see happen is someone's sitting for a long time. You're sitting for a long time. You overstretch those ligaments or muscles, and then you go to stand up and So just doing something for a long time is a common precursor to a back strain. Yeah, yeah. What about you, Dr. Bay?
I've had two probably that were significant, but never so much where I felt like I threw my back out.
Okay.
One was for the first time, but I was an adult already. I did some partner work in ballet, and I kind of got bent to the side in an extreme position, and I felt a pop in my back. And I felt like it was more a strain of my lower ribs. Not just, it was tender and unstable for a while. And then the other was I had taken my first kind of CrossFit-y or circuit-y class, and there's a reason I didn't play competitive sports. It's because it's not, my best side. So I got too competitive, but really I think with myself. And the finisher on the class, what was called an AMRAP, which is as many rounds as possible. And it was V-ups and hip flexors have been a tender thing for me. But I just kept going on super speed, even though I could tell I wasn't using the right muscles. I was just forcing it to happen. And then I like had cramping in my back from my hip flexors for weeks. So I don't do that anymore. I remove myself from those competitive situations.
Well, that's super common with our patients.
Yeah.
I hear that all the time.
Yeah.
Yeah.
So
Yeah.
I learned from that.
Yeah. It's
She gonna
just
learn today.
overdoing something, right?
Yeah.
Overdoing something. It could be exercise. It could be playing too many games about, on a weekend you go in a tournament and play a bunch of basketball games. It could be
Yeah.
something that's different that you're not doing. You just put yourself at risk, really straining anything in your body.
Definitely.
Or spraining anything in your body.
Yeah, so
Or-
I didn't
no.
listen to my body. I kept going. This is why we preach continuing with a well-rounded program, always staying consistent, because then, like Dr. Brown said, your body has the ability to adapt more easily.
Yeah, absolutely. Well, we get injured too. We just want to share with you. It's not just you. So if you're struggling with an injury, if you have low back pain, if anything that we said maybe makes you think that you have a sprain or a strain, we would love to help you. We see clients here in the clinic. If you're in the LA area, so you can come on in, clients and patients, and here, or we also see people across the country and the world via telehealth. It's very successful. We've helped a lot of people across the world who just didn't have a good person on their team and they wanted to get back to a sport or an activity that they can't do or are struggling with. So you can reach out to us via all kinds of places. You can call us, you can email us, you can Instagram or Facebook DM us. We are everywhere. All of our contact information is online for you guys to reach out. So don't struggle with the pain. Don't struggle with the injury. If you're not able to get through it, get some help. We'd love to help you. Also, if this is your first time tuning in with us and watching this YouTube video or listening, there are 43 more episodes for your viewing and listening pleasure for you to check out on all kinds of injuries, all kinds of diagnoses, all kinds of tips and resources that we love to tell our patients, kind of our sauce, the things that we typically say over and over again. So go check those out. You can look on, all our videos are on YouTube and on our website as well. You can see our podcast, our YouTube, and any listening platform that you like to listen on. So Spotify, Amazon Music, iTunes, really anywhere that you enjoy tuning in. And if you're a reader and you love to read, you can go read our blog in full version on our website and check out those as well. So lastly, if you're looking for tips and resources on things that are going on in our clinic or just the newest and updated things that we have going on, you can go on our website at physicaltherapysanpedro.com and you can subscribe to our email list. And you might want to do that if you're interested in any of our online programming, because on June 1st, exciting news, we are releasing the first of our online programming, which is going to be our ankle pain program. So that program is going to be for anybody who's dealing with ankle pain or an ankle injury and maybe doesn't have access financially or to get to someone to help them. It's a really great 4-step or 4-phase program to help you move through ankle pain. And we'd love to help you with that if you are interested. So that'll be the first of many. And so if you want to hear about the promotions that we're offering for this program, or you're interested in potentially purchasing that, go on our website and subscribe to our email list and we'll get you information on it so that you can join. And I think that's it. I think that's all we have today. We thank you for tuning in and we will see you next time. Bye.
Bye.
Bye.